Hello instructors! Here is the project plan presentation for Team 2. Our project is the pre- and post-care operative instructions. All patients who are going to have procedures or recovering from surgeries would like to have a doctor standing by 24/7 to provide guidance and answer questions. However, this kind of care is unlikely to happen for most of us, no matter how good your insurance is. A published study in the journal Annals of Internal Medicine showed that half of the patients made significant errors in 2 months after being discharged from the hospitals. In an interview by Kaiser Health News, Don Goldman, the Chief Medical and Scientific Officer at the Institute of Healthcare Improvement, said the episodic care at different places, at different times, is not designed to keep the overall safety of the patients in mind. That is to say, the variety of providers, such as urgent cares and pharmacies, that patients may visit after hospitalization or procedures, may cause inconformity since they may not be very familiar with the patient's situation. Apparently, if a platform can bridge between physicians and patients to guide patients with home health care, will help to avoid some errors. The good news is that, with the developments of health informatics and technologies, websites and applications are now being developed to provide personalized healthcare. While these platforms cannot replace real office visits or hospital care, they are indeed helping patients with conditions that can be handled by patients themselves with proper instructions. Hospitals and care facilities already started to use apps such as Seamless MD, TapCloud, and Track My Recovery to support patients through preparation for and recovery from hospitalization or surgeries. In this project, we will mimic this kind of platforms and develop a web application to provide patients with care instructions. On our webpage, providers have retrievable documents of procedure instructions. They will be displayed for their patients who are undergoing those procedures. For demo purpose, we will include 5 instruction sets: hernia repair, bone grafts, biopsy, appendectomy, and coronary artery bypass graft. And we will consider at least 10 SNOMED codes as shown here. Codes in orange boxes are parent codes, while those in yellow boxes are child codes. Both physicians or providers and patients can log in our platform. When a provider decides to conduct a procedure for patients, he or she can relate this patient to the procedure. Once the patient logins later, the system will remind him, hey, you have an upcoming procedure, and provide preparation instructions. Or, if the patient has been recently discharged from the hospital, his physician can also assign post-operative instruction on our platform. At the same time, we have a message channels. From there, patients can message and let their doctors know how everything is going. The app will facilitate improved engagement between patients and their care team and enhance the patient's quality of life, thus reducing costly readmissions and post-operative care. Clients can connect to our website using any browsers. Our application will be hosted in Kubernetes. It will fire GET requests to the FHIR API service in order to retrieve the search results for the client machine. This is our project plan. We have 4 phases: project research and requirement analysis, project architecture design, project implementation, and testing. Front-end team will be working on displaying the patient login portal as well as the search results, while the back-end team will be building up the backbone of the app, including API connection as well as deploying to Kubernetes. Last, the whole team will manually test the app. This is the end of our presentation. Thank you for your time.